Hello everyone, welcome to another video. In this video we'll be talking about the anatomy of the orbit and the different bones that make up each side of the orbital wall. We'll start by talking about all the 7 bones, the ethmoidal, frontal, lacrimal, maxillary, palatine, sphenoid, and zygomatic. It's actually a fairly common PIM question, so try to remember this. We'll start by talking about the superior orbital wall. It's made up of the frontal bone and the lesser wing of the sphenoid. Some notable structures include the fossa for the lacrimal gland, the trochlear fossa, which is located medially, and the cribra orbitalia. And I'll tell you a little bit more about that once we get to the pictures. So all of this is made up of the frontal bone, okay? And this right here, if you can see the suture lines, this is the lesser wing of the sphenoid bone. Now right here is where the lacrimal gland lies. This indentation right here, that's the trochlear fossa. And cribra orbitalis is actually a pathologic condition. And you won't see it in everyone, but I have this picture right here. Based on my reading, it seems like patients that have anemia seem to have this, but you won't see it on everyone. Next, we'll talk about the medial orbital wall. It's composed of the ethmoid bone, which is the largest portion, the lacrimal bone, the maxillary bone, and the lesser wing of the sphenoid. Some of the notable structures include the lacrimal fossa, formed by the maxillary and the lacrimal bone, and lastly the lamina propria. We have that image right here. If you could see, this is all ethmoid. There's suture lines right here. This portion in the back, that's the lesser wing of the sphenoid. This right here is the lacrimal bone, and right here is the maxillary bone. So if you notice, it makes part of the medial wall and also part of the inferior wall. The notable structures, the lacrimal fossa is right over here, and the ethmoid actually is also known as, or part of the ethmoid is called the lamina propria, and that would be right around here, right here. This is just a zoomed in view. Now let's talk about the inferior orbital wall. It's formed by the maxillary bone, the palatine bone, and the zygomatic bone. Some notable structures include the inferior oblique muscle, which arises lateral to the opening of the nasolacrimal canal. I'll show you those right here. So it's a zoomed out view. As you can see, this is the maxillary bone right here. This is the zygomatic. And unfortunately, the palatine is all the way in the back. So it's very hard to see unless you have a cross section right across here. But it's that bone right over there. Okay? And this is just zoomed in. This is our nasolacrimal canal. So the inferior oblique muscle arises lateral to that. And you can see it's the maxillary, palatine, and the zygomatic. More zoomed in views. And just for the sake of completion, so you guys can get a better image, the palatine is this yellow one right here. This image is off of Google, so I did not make this image. Lastly, let's talk about the lateral orbital wall. It's composed of the zygomatic bone and the greater wing of the sphenoid. Some of the notable structures include the Whitnall tubercle. It gives rise to the Whitnall ligament, the lateral palpebral ligament, the check ligament of the lateral rectus, suspensory ligament of the eyeball, and the aponeurosis of the levator muscle. Now, this is not something that a medical student would be expected to know, but if you're a resident in ophthalmology, then it's probably a good idea to remember these. And I'll show you all of these right here. So zoomed out version, or zoomed out view, this is the greater wing of the sphenoid. And this right here is the suture line, and the rest of this is formed by the zygomatic bone. Okay, and Whitnall tubercle. So it's kind of hard to see, but if you can, there's a ridge right around here, and I believe that's the Whitnall tubercle.